A second case of monkeypox has been identified in the country. The National Department of Health is calling for vigilance and for those experiencing symptoms to report to their nearest healthcare centre. Joining me now is Deputy Minister Dr. Sibongiseni Dhlomo on this matter. Dr. Dhlomo, thank you so much for your time this evening. I mean, surely we almost could anticipate that it was going to land up on our shores when it comes to the monkeypox. Now a second individual has been identified to have contracted the monkeypox. But what do we know so far about this individual, as well as maybe perhaps how did he even or she contract this virus?
Thank you very much. Good evening, and good evening to your viewers. The only information we do have is that he's a 30-year-old South African in Cape Town who also has no history of travel and has actually got a positive response from the laboratory test of a monkeypox. That's all that we have. They are still tracing and investigating if the relatives or any that he has got close contact with could also be having or developing the monkeypox. Look, it could have been someone who traveled and visited and came to our shores. We don't know as yet how these two cases, second one being today, have come up to be having monkeypox.
You know, Dr. Sibongiseni, as you're speaking about this, it almost appears as though there's still a lot that we need to learn about this. But what do we know so far about the monkeypox, the way that it actually spreads, the virus in itself? And I mean, as you're saying, this individual does not have a record of traveling. If they don't have a record of traveling, where did they get it from?
Okay, we know that monkeypox has been there in Africa, North Africa and West Africa for almost over 20 years now. So it's a new entry into our country, South Africa. Hence, we have to report it. It's a very self-limiting, less severe disease compared to what our grandmothers would have told us as a smallpox. It also presents with these blisters on the skin, face, and the upper trunk, and they're itchy, and in most cases self-limiting. And it can come with like fever. It's a viral infection. We also know that it is not as severe in terms of spread, though it's an infectious disease. But if I were to join you there in studio, I sit on the other end, you sit on the other end, you may not get it until we have a close contact, shaking hands, touching hands with my lesions on my hand. Then you could also get it. So we are just sending an alert to South Africans, but we don't say people must panic as compared to where we come from, where in the room, if I cough and sneeze with COVID, you could get it easily. This one, it has to be that close contact to another individual.
Yeah, and allow me to labor on the point a little bit here, Dr. Dhlomo, because as you're saying, it is new to South Africa. It's not something that is a viral infection that is common in the South African context. It is common in other countries, however, north of the continent. In that case, if this individual did not actually travel to any other country, we surely should be able to say, where did this person get this monkeypox from? And also, if they did not travel and yet they've got it, and if it's a new phenomena in the South African context, does that not mean that there are other individuals who could potentially have the virus but have not presented themselves before health professionals, and therefore we are not able to document them? Somewhere, somehow, this individual who has not traveled ended up with the monkeypox. So clearly, somewhere, somehow, the numbers may have been missed, or maybe one individual may have been missed, and maybe the numbers are not necessarily two. It's just that it's two that we know of.
Yes, you are correct. That is why there's a contact tracing. Who visited these two? Could it be me, who probably might have traveled and I visited this person? Or could it be any other person, wherever it has been, in traveling around in the community? So we don't know as yet, but surely this monkeypox came from somehow, from somewhere, either me visiting that family, and I have monkeypox which remains asymptomatic with me up to today, or it is also going to be picked up when we trace the contacts. So we will be keeping you up to well informed as to what are our findings so far. We rely on the national NICD to really get to know where this infection comes from and what are they finding from even the close contacts of those that have actually been found to have a positive monkeypox for now.
So can we then concede, Dr. Dhlomo, that the number may not be 2? Indeed, we may have more people who have the monkeypox in South Africa. It's just that we do not know about them, given the circumstances of the way in which this individual was infected.
Yes, I can't rule out that possibility. You may as well probably be having some symptoms but not showing as yet, and therefore it shows in me when I actually get it from you. So I may not rule out a possibility of another person that we may not have picked up that may have a positive monkeypox already.
So you're saying that it does not necessarily, it's not a highly infectious. What about all of those who got immunized, for example, for smallpox, or when we were growing up, we were calling it the chickenpox, right? So we all had to get immunized against the chickenpox. Does that mean that if I'm immunized against the chickenpox, I may not contract monkeypox? How does it work?
It's not the same family as like that. We were all immunized against them. Firstly, me and you never got to be exposed to smallpox because it was eliminated before we were born or youngsters. The chickenpox, we were immunized, me and you, but however, we may still get a breakthrough of some few cases of chickenpox, even in adults and in younger people. So you vaccinate a whole host of children with one for chickenpox, but 1 or 2 breakthroughs you see in particular schools. So all we do is to say, these children stay away from home because the other children may get chickenpox, but it may not be that severe because they were vaccinated against it. This one is a completely new disease. None of us as South Africans have got any vaccine against monkeypox. It's a new disease we have never seen. Our bodies will be experiencing for the first time. But what is a solace with this is that it's a very self-limiting. It will leave you with a bit of some scars and lesions. We have not even in those countries where there has been an outbreak of monkeypox experienced deaths, especially in Africa. So it's a very self-limiting, a bit of an inconvenience to have it, lesions here and there, itchy, that you need to scratch and put some lotions to make it to be less itchy. But life moves on much more. Look, I will still be worried to date because when we started with COVID, I said, we may have to really push our personal hygiene levels with COVID. This is also calling for that to say, maybe let me just be careful before I shake your hand. When last did you wash your hands? When last did you do this, that, and other? So our personal hygiene space will also kick in here and avoid getting those. It spreads by contacts. Real close contacts physically, yeah.
We'll leave it there. Deputy Health Minister Dr. Sibongiseni Dhlomo, thank you very much for your time this evening.